is, as Dr. Kuti has alluded, and as we reported last week, I think this week, we are in the process of adopting new protocols that have been issued by the World Health Organization, particularly those to do with management, whether it's quarantining or whether it is release of positive cases. Now, I would like to make it clear, because I saw a report to the effect that once we start doing that, then there will be explosion of the disease in homes. I would like to make it clear that the people who would be released, first and foremost, all positive cases will continue to be isolated. Let's start from there. All positive cases must be isolated for a minimum period of, as will be advised by WHO, and as we ourselves in the country also determine. WHO, for example, is talking about 9 days, but we might also ourselves decide to hedge that a little bit more, and just to see whether we release people after 14 days or so, because we have a lot of people who are in isolation. They have already gone over 14 days. They are still positive, and the protocols that are being developed are such that those people apparently, and I'm going to ask Dr. Amoth to speak to this, do not transmit the virus. So it is not that we are saying that positive cases from day one are going to be in people's homes. No, that's not what we are saying. Secondly, as in regards to the issue of the new directives by the president, particularly the 300 beds that we are looking for, as I said, some people have some counties already have this capacity. Others need to bring it together to sort of move beds and so on together. And I would like also to urge that because we are not talking about treatment beds as such, the 300 is isolation, that we use a local Juakali produced beds. That way, we create a lot of opportunities and we create a lot of jobs. I have seen, for instance, when I visited Machakos County, I saw that their field hospital is filled with beds that have been made by the Juakali sector in that county. So I want to urge that even for the other counties, let's make use of our local production. At the same time, the use of masks, we are also going to be producing a large quantity of masks, and we have also agreed that the counties are going to get involved, especially the reusable masks. Our prayer on this one, on the reusable masks, is that reusable means that you can wash the mask in the evening so that it is dry by the morning, and then you use it again. You should not use it on day-to-day basis without cleaning it. That's why it's reusable. It's reusable if you wash it. If it is not washed, then you're not using it, because the cleanliness, hygiene, when you've been breathing into something, then you need to make it clean. So just to highlight that one, and the issue of urging local production on the issue of masks, spreading the tailoring of the masks as widely as possible, because KEBS has already given directives on this one. But on the issue of home quarantine and home isolation care, I want to ask Dr. Amoth to address that particular issue.